Okay. Am I live? I am live. Wonderful. So, everybody, welcome back. Oh, you see, this is the problem. You bring people together and they want to network. So, I'm going to try and get everybody back in the room. And I'm not doing a good job. So, everybody, we are going to start the afternoon. And one of the reasons I want to get you stopping networking and listening, if possible, is because I'm going to be introducing a spoken word poet, and I want you to be able to listen to that. We're going to kick off the afternoon with a special performance by Ritalin Franksen. He's been with us all this morning and will share his thoughts in spoken word. Now, Franksen was raised in Scarborough, Ontario by his single mother who taught him the value of education, hard work, and perseverance. She knew that if he was ever going to make anything of himself, he would have to work twice as hard and to have half of the privileges of others. She also taught him to be strong so that he could push through barriers and obstacles in a world where black men are not expected to succeed. He has never forgotten these lessons. They shaped his path and they influenced who he has become. Now, since 1990, Greg has left his mark in every community he has called home through his work in education, the arts, and political activism. He is a proud Queen's alumnus, highly accomplished spoken word artist, organizer, and an award-winning social activist. More importantly, he is passionate about social change, dedicated to community service, and intent on leaving a positive legacy for his 3 daughters. Please join me in welcoming Ritalin Franksen.
Thanks, Kwame. I'm going to prop this somewhere. I'm just going to leave it there. Hey, everybody. How's it going? Wow. I have like a projection, a voice. It's amazing. All of us have a voice, and I feel privileged and honored to be able to share my voice with all of you good people here today. So I actually was quite prolific during the morning, so I don't want to waste too much time. I'd rather read poetry than talk about anything else. So right from the beginning, when Kwame got us started, I started to write a poem about what he was saying and some of what we saw in the videos. And so this first poem is called Welcome to My Toronto. My Toronto, our city of diversity as its strength, an inclusive place that states its pride boldly on its sleeve, a city of championship pride, making and taking strides to be a beacon to others and a place of nurture and support. From the subways to the streets, to the zoo and to the port, unwilling to contemplate defeat. This municipality, in the words of our mayor, is committed to the process of conversation, crucial to determining health as key to every situation in which its residents must exist, engaged with a room full of solution makers from around the globe who persist and push for better, in concert of thought and action, who remember never to remain content, nor to descend into factions. For the opportunity before us leaves a challenge to what comes next. When it's time to leave the room, day concluded, so we must keep such thoughts in context. People on the streets identified a variety of issues to confront: access to housing and employment, homelessness and transportation, mental health in our changing climate, as well as the disruptions of growth. These tests and so many others force us to remain on our toes. But we, this city, stand undaunted in the face of such challenge. Arm in arm with our visitors who bring our context new balance, we shall never be denied. The future faded in this place with linkage back to health equity. We are left without a trace of hesitation in our mission to bring everyone up to higher levels. We will work harder together to solve the problems that could bedevil lesser people unable to achieve new progress. So lean in with tenacity to your civil blessing. Remain resolute for my Toronto, for a future both present and pressing. So then we had the opening panel, and I wrote a couple of poems about what I heard there, but I do also want to share a few of my haiku. So I've written something in the order of like 16 haiku this morning. And those of you may remember what a haiku is. I'll tell you. First 5 syllables, then you write down 7 more, 5 more, and you're done, right? So it's very simple, okay? So I'm going to read a couple of them for you just to give you a sample of what some of the things are that I heard. Beginning at the beginning, again with Kwame speaking his acknowledgement of the land. So the poem is very short. Acknowledge the land. Permission to congregate begins with our thanks. That's it. It's a haiku, it's over. All right. I'll share another one. Toronto Foundation asks, where is it we should fit? Where heart meets wallet. And that's my segue into the poem that I wrote about that particular address, talking about the issue of philanthropy. So I wrote a poem. It's called Philanthropy. And it goes like this. Philanthropy is a system, wealth, funds, power, inequitable at its core, broken in its application that creates an environment for war. In its self-perpetuation, it cannot see the other assets left behind by privileged giving. Walls must fall like Jericho's, tumbling in the face of a new vision. The course of action most needed is to challenge unfettered dominance of a status quo, to create a dynamic that spins with more plans in its orbit. Confront the philanthropic system and see what is possible when those with the funds find heart, and those with heart see funds that elevate all our hopes full. That's it. A short poem just about the switching around of the ideas of spaces and places that we heard from the head of the YMCA. It's a very cool concept, and so I wrote a very short piece about that. It's just called A Space of Place. Create a common vision for the insides of our spaces and transform our buildings into powerful places. Let's give back to instigate new bonds of community, to spur people into novel applications of their purpose. Embrace a sense of belonging that loves with impunity, and residents can find themselves below their conscious surface. If we are able to find success in this pursuit, all win. We shall become a single organism, socially cohesive within. Thank you. Another haiku. When our network of love is visible, we are at our very best. That's it. And let's see another one. Oh, here's one that's directed at Kwame. A catchy slogan, not left, not right, but forward. Words we must make real. Okay. So then I started jumping around to the different breakout rooms. And the first one that I ducked into, I heard David Jones from Philadelphia speaking in the Cities and Mental Health room. And so I just got a little quick clip of what he was saying, and so I share a bit of it. It's called Codes of Health. Zip codes. We got to track them. People alive to the issues know they determine the outcome. Access to service secondary to those 5 little digits. What's the deal on postal codes when we migrate north of 49? If we conduct similar surveys, anything different that we find? Better health is fundamental, whether mental or physical in scope. But when we break it down successfully, we zip more quickly towards hope. Then I tucked really quickly into the inclusive infrastructure presentation, and Annalie from the city of Toronto, she was going off on buildings and vertical living and all kinds of stuff. And I immediately started writing a poem. I'm like, I'm down for this. I'm an urban geography nerd, so I was like all over that. So I started writing. And this poem is called Vertical Vision. We are on the come up, so look up, way up. What does a new community look like? We have a lot of stories to build and more stories to be written. A new history to tell as the future of our city is vertical. And we're merely passengers on the roller coaster that climbs ascendant. What to do when we reach the peak? The high rise of space scarcity interacts with social pressure to impact our sight on the sites we parcel for this new future, and how it's delivered truly matters. For it is through the eyes of our children who grow up in these environments that our choices of today shall be judged. So look up, way up. For Toronto is on the come up, and to see it in reality, we will all need to be ready. Thank you. Then I went into the other panel room on affordability for health. And as soon as I got there, I wrote a haiku, which goes, people with power reinforce majority of our exclusions. Thank you. So I didn't write specifically about any one person in that room. I kind of wrote reflecting on what all 3 of them were saying, because it was all very powerful stuff, which led me to think on the idea of power, which of course in French is pouvoir. And so I wrote a poem called Pardon My Pouvoir. Le pouvoir, pardon my French. What the heck does that mean today? Let's face reality that some faces who don't face the same chases as other ethnicities, finances, and races will erase any trace of progress if we digress from a focus on an inclusiveness that for a true majority works best. We must stress that to balance the interests of those not blessed by the investments and bequests of past treasure chests created and retained through the mess of nothing less than how power blessed by mandarins and robber barons reinforces past wins and sins within systems that don't let everyone in. It is a measure of how we measure. That whenever we discuss treasure, the pleasure of fair weather social framers who speak and seek an internal cross-purposed opposition perpetrate the conditions that operate on suppositions demeaning to a truly meaningful reimagining of the tragedies that limit our desire for change. To exercise power differently, it must be rearranged. Therefore, we must ask again about le pouvoir. And this time, don't pardon my French, for what the heck does that mean today? So thank you, folks. I've written all of these poems. I have a whole bunch more haiku. There's all kinds of stuff in here. And I've been really grateful and feel privileged to have had the opportunity to be a witness, to be a fly on the wall, and to be a poetic translator of what's happening here today. And I'm looking forward to sharing and creating more of my work, and to giving you an opportunity to hear more of it later on in the evening. So thank you, guys. And best of luck to everyone out here today, and appreciate your time and attention.
Okay, so this morning when we started, most of the voices, most of the panelists were from Toronto. They're our Toronto voices, some of our Toronto leaders. And we have a different sort of panel, a more mixed panel, still with some people who are working in Toronto and now working at the national level, but also with people from elsewhere, people from the States. Now, you know that recent polls have shown that climate change is one of the top voter concerns for the upcoming election. I say upcoming election, it started, hasn't it? It started. It's going to be a wonderful 6 weeks. At the end of it, yeah, you are going to be happy and you're clear exactly, you'll be clear who you're going to vote for, but you won't be clear what you're going to get. Anyway, that's a different thing. Right. And next, we have an exciting panel from resiliency officers. And we've got the resiliency officer from Boston, from New Orleans, and from Toronto. And they're all going to share challenges and opportunities in working towards health equity in their respective cities from a perspective of the resiliency work they've done in their cities. Now, I must say that resiliency officers have a certain shelf life because of the way the programs worked. And so we sort of have ex-resiliency officers with us, but they are resilient, so they're still here to talk about it. We're going to start with Jeff Herbert, who is a partner in HR&A and advisor. And he's a former CRO of New Orleans, so Chief Resiliency Officer. He's a pioneer of resilience planning and community revitalization. He works with cities around the world to develop strategies that mitigate future social, economic, and physical shocks and stresses. He previously served as the City of New Orleans as the first Deputy Mayor and Chief Administrative Officer, and he has been the Chief Resiliency Officer amongst other things. And he looks young. He looks young. He looks young. So whatever you've done, it hasn't aged you, man. You've done well. Some of Jeff's accomplishments includes the city's green infrastructure program, the city's first climate action plan, the award-winning resilient NOLA comprehensive resiliency strategy, and the $140 million National Disaster Resiliency Competition Award. Prior to joining HR&A Advisors as a partner, he served as a vice president at the Water Institute. Jeff, please.
I'll go to the podium. Kwame, thanks, and thanks to the Wellesley Institute for the invite here in Toronto. I'm happy to be here and happy to know that it is as humid here in Toronto today as it is in the two other places where I call home, New Orleans and New York. So it's nice to be here. The last time I was here, that was not the case. It was quite cold. What I want to talk about is really thinking about resilience from the perspective of the individual, because I think when we think about public health and health outcomes, and particularly in the way that I think about resilience and the way that we have thought about resilience in New Orleans, is really about the ability of an individual to live in society and be able to thrive in that society. One of the things that I think is a conversation with the word resilience is resilience has been used a lot of times to think about survival and how do we survive tragic events. Today is 9/11, And for me, it's a bit emotional, as I was actually in New York during 9/11 and actually saw the towers collapse. And we started talking about resilience and the resilience and the ability for people to bounce back. But it's really about thriving, not just about surviving. And I think the themes that I've heard in the sessions today really parallel that. What's often forgotten also is that all of this happens at a nesting of scales between the individual, the community, the metropolitan, and of course at national and global scales. We understand what happens at the metropolitan scale most often because that's where a lot of the financing goes towards buildings and infrastructure and all these hard assets. But what has been less invested in, and perhaps is more impactful, is the investment in people and communities. Because at the end of the day, all of these structures are inhabited by people, and the ability for people to survive is what will carry us through. So resilience begins with the individual. What we determined is that the people of New Orleans needed the tools and resources necessary to survive and thrive in the face of devastation caused by changes in the climate, in the economy, and the possibilities that these things compound each other and make situations far greater, increase vulnerability among populations that are already vulnerable. And these nesting of scales is what allows us to be able to think in that way. Only when the most vulnerable individuals in our communities are well supported and prepared can we truly call ourselves resilient cities. What we've seen in New Orleans in the aftermath of Hurricane Katrina, and in New York after Hurricane Sandy, and time again in Australia and Japan and in parts of Africa, is that disaster exacerbates existing challenges. The challenges that you see on television after a disaster, the challenges that you are actually currently seeing in the Bahamas, the challenges that you saw in Puerto Rico and Haiti and places on and on again, are challenges that already existed before the disruption occurred. It's just that that disruption exacerbated the conditions that were already present at the time. So we had to think of a new approach about how to do that. And our approach was the impact on human lives is the first thing that we have to think about before we think about infrastructure challenges, before we think about everything else, because in New Orleans, being resilient meant more than the levees holding back the floodwaters, more than the wetlands protecting the city from storms. What it meant was striking a balance between human needs and the environment, while also combating the chronic stresses of violence, poverty, and inequality. And so we came up with 3 themes to really think through this that I will get into further detail later. One is adapting to thrive. How can individuals adapt their lifestyles to thrive in the changing environments that we are currently seeing and are projected in the future? 2, how do we connect individuals to opportunity so that they actually can invest in their own livelihoods in ways that are more equitable and more supportive than what we've seen previously? And 3, how can we transform the systems of city government to be more equitable, inclusive, and transparent in the investments that the city makes in communities overall? So I'll get into more detail about this as the panel progresses, but the takeaway is, in many parts of the US, the thought process around resilience has been on the large-scale infrastructure solutions and those things to protect cities in the United States, a very sort of engineering approach. But as we've started to think through this, and you will see particularly in Atiya's presentation later, we've really focused more on how to prepare individuals for the changes, because what we know and what I've learned from a lot of people in the public health world is that social cohesion is a determinant of how successful a community can be in the long term. So building that social cohesion at the individual level becomes more and more important as time goes on. Thank you.
Elliot Capel is a former Chief Resiliency Officer at the City of Toronto. In his role, he led the development of Toronto's resiliency strategy and the city's participation in the Global 100 Resilient Cities Network. A native Torontonian, in fact, your mother lived around the corner from me, didn't she, your mother and father? Yeah. Elliot has held various roles in the government of Ontario and worked with Global Affairs Canada. He is passionate about adaptation, urban development, the environment, and wildlife. Elliot has worked in over 20 countries internationally, including in Africa, Asia, the Middle East, and Europe. He holds a master's from London School of Economics and a BA from McGill University, so therefore we've got some francophone here. I was going to say, pardon my pouvoir, but there you go. Okay, please, Elliot.
Good afternoon. I'm going to be as brief as possible because I want to spend as much time talking with my colleagues. When I'm asked to summarize Toronto's resilience strategy and our approach, I say we're basically about two things. The first thing is that climate change is real, and as a result, Toronto is getting hotter, wetter, and wilder. That's part one. Part two, which Jeff spoke to, is that we all experience resilience differently. And it's the interplay of those two things that we really wanted to focus on. And there are a lot of things about equity and vulnerability in Toronto that need to be addressed. And there are a lot of things about climate change that are outside of how we adapt to a changing climate that we need to address. But really, we wanted to focus on where that risk from climate change and the vulnerability, mostly due to equity issues in our city, overlap. And it's really that overlap where you see the intersection of climate change and health. So let's take each one of those on its own: hotter, wetter, and wilder. When we think about a hotter Toronto, some of us think that's fantastic. But for the 500,000 or 700,000 Torontonians that live in older, aging apartment towers, their apartments are already hot when it's not that hot outside. And so when it gets to 26, 27, 28 degrees, there is a future in which those apartments are not really going to be inhabitable for several weeks of the year. And if you think it's hard to find an apartment in Toronto right now, consider the fact that these older apartment towers make up 45% of our rental housing stock. So that's the risk. That's where we see the real risk of people being exposed to heat waves. But then we think about the vulnerability side. So, who's living there, right? And we see in older apartment towers that you have that agglomeration of more vulnerable groups, people with mental health problems, single-parent households, new Canadians, people who are at high vulnerability in climate events. So again, when we think about hotter, there's that intersection in older apartment towers between people who are at highest risk and those who are vulnerable. Let's think about wetter. So who's worst off when we have that overland flooding? It tends to be the people who live in basements, right? And we're going to have a lot of complaints coming in from what happened last night. How many people live in basements in Toronto? We don't know. We don't track it. Not all of the suites are legal. But we're in U of T. I'm sure there are hundreds of students in this building right now that live in basements in Toronto. And it tends to be, so that's where our risk is pooled, but it tends to be that when you're living in a basement, as you know, when I started out living in a basement, I didn't have insurance, right? I didn't have private health insurance. So you have that vulnerability and that overlap of risk and vulnerability. I always say that, when we think about basements, one of the numbers that ticks up is insured losses, right? Insurance companies are losing a lot of money paying out for flooded basements. But the way that we track it right now, if you have a wine cellar and it floods out, that's an insured loss. But if you have a new Canadian family living in Little Italy and they lose their home, we don't track that, right? So there's a lot of misconception around flooded basements that it's about homeowners losing an entertainment room or 60-inch television. The truth is that there are tens, maybe 100,000 people living in Toronto in basements, and we need to think about that flooding risk. And then wilder. The main consequence of almost any one of our wild events, windstorm, ice storm, would be a loss of power, right? That's where our risk is. And who's most vulnerable? Again, it's the people who are living higher up on higher floors, who can't get up and down, who have mobility issues. It's the people who are really relying on the food in their fridge and their freezer to feed their family till the end of the week or the end of the month. So when we think about hotter, wetter, wilder, we have all these sort of risks, and then we have vulnerable groups, and there are a lot of issues that we can look at in either the risks or the vulnerabilities, but the resilience strategy really wanted to focus on the overlap between the two, and I think the link to health is fairly clear. So what do we need to do about it? Well, obviously we need to implement the resilience strategy, but with this group today, when I look around the room of a lot of experts and a lot of people from community, I think that's the right mix. We need to have a much better understanding of what our climate risks actually mean, how much hotter, how much wetter. We don't, for example, have a flood risk map of the city, so we don't know which homes. We may know intuitively which homes and which intersections are at most risk, but we don't have a way to measure that. And then we need to pair that with the people who really understand and get and deal with vulnerabilities on the ground. So just as was started saying, the resilience strategy was about two things, hotter, wetter, wilder, and the fact that we all experienced resilience differently. When we think about implementing, I think the number one priority has to be matching our expertise in climate risk with the people who have the reality on the ground, interfaith groups like Scarborough Storefront, who are on the ground working every day trying to make Toronto a more resilient place. I just want to finish by thanking Wellesley for having me, but also for bringing in former CROs from New Orleans and Boston. And for those that are unfamiliar with the 100 Resilient Cities Network, New Orleans and Boston were both cities that really influenced our thinking. And when we thought about New Orleans, the first thing that came to head obviously were the shocks and that interplay between shocks and stresses. And then we were also, I would say, very strongly influenced by what we saw in Boston, who were looking at racial equity and resilience. And that was a theme that really, I can't tell you how much of a guiding light that was for our work. So I'm really happy that of all of my, CRO colleagues, that these are the two that we have today. And thank you, Jeff. And I really look forward to hearing from Atia. So I'll stop there.
So, Atia Martin has spent the last 16 years in federal and local government within intelligence, homeland security, emergency management, public health preparedness, and ultimately, resilience. Prior to her career in public service, she also worked in the private sector in technology, business development, and administration. She's currently the CEO and founder of All Aces Incorporated, a social enterprise that provides a range of products and services to put clients in control of difficult conversations and situations. All Aces' mission is to activate the power of consciousness and critical thinking to build personal and organizational resilience. Previously, she was the Chief Resilience Officer for the City of Boston. Atia.
All right, so how's everyone doing this afternoon? Yes? Okay, so I have good news and bad news for you. The good news is I have a lot to share with you, but I have two caveats. Number one, in true Northeast United States fashion, I'm gonna go really fast. And number two, I'm gonna ask for your help. So this is gonna go fast, but you're also gonna participate. So that being said, I'm gonna jump right in. So you already heard about our organization. That's all my contact information because my staff told me I should do this, so I'm doing it. There it is. You all are my witnesses that I put this slide up here with all the stuff, okay? And the work that we do really is about dealing that controlling hand that was mentioned before, because much of what we deal with in life is about how we respond to the challenges that we face, right? Only about 10% of it is about what actually happens. And all of our work is centered on racial equity and resilience. You need racial equity in order to have better resilience, and you need resilience in order to do racial equity work. We'll talk more about that. And all of our work centers and focuses on some key areas that we really have developed expertise in. Now, which leads me to this conversation around resilience. So, right now in resilience, we oftentimes talk about the economic stuff, economic resilience. We talk about physical resilience in terms of infrastructure, and we oftentimes talk about this environmental piece. We hardly ever talk about social resilience, and when we do, we like feel really good and excited that one time that we talked about it or heard someone speak about it, right? And then we hardly ever talk about the realities of people in the context of all of those other domains of resilience. That being said, how do we recenter people in this context? And if we're going to recenter people, then that means we actually have to look at equity, because we all are not living in the same reality in any country in this world. So I'm going to talk about Boston, the context of the city of Boston, and what we deal with in terms of the population. So these maps that I'm showing you are actually called Hotspot Maps. It's a concept borrowed from law enforcement. And so you'll see the redder the spot, that means the more people are highly statistically concentrated in those areas. You with me? And the blue is the opposite. That means that's the least amount of people in those areas. So I want you to pay attention to the pattern. So this first one is social isolation. It's a proxy. There is no census data in the United States for social isolation. It's people who are older adults who live alone, and it's single-parent households, which are two within the literature of the most vulnerable populations that we see before, during, and after emergencies in our communities, whether it's climate change or any other kind of emergency. Low to no income. I want you to notice this pattern here with these red spots, right? You still have this area of Boston. You get some other pieces, but you still see this center area and the southern area of Boston. When we look at people with disabilities, they're also statistically highly concentrated in these areas. And when you look at children, they are also highly statistically concentrated in these same areas. And this last one was a shocker to me, this one and the one with people with disabilities, but then also this one, people of color. People of color also are highly statistically concentrated in these areas. And what do we know about social determinants of health? Which social determinant is the most significant in terms of the data? Don't be afraid. Someone thinks income? Race. The data shows that race is the biggest social determinant in terms of poor outcomes in people's lives on a day-to-day basis. You layer that on top of disasters and emergencies, and now you have social determinants of vulnerability when you talk about climate change and emergencies. So we are super uncomfortable with talking about it, but we are going to very quickly talk about it with my 1 minute left. So when we talk about racism, what we're really talking about is a historically rooted system, has a long history of policies and practices, and I'm going to speak to the United States, but this is a global phenomenon. We're not special. We actually imported it in from Europe, right? So this is a global phenomenon. And the centerpiece of the ideologies, right? The ideas that perpetuate people of color being inferior and having no power or powerlessness, and white people being superior and having power. Period, end of story. But here's in terms of being explicit. But I want to point this out because we never talk about this fact, that racism actually hurts people of color and white people. You want to know how and why? Ask a question when we do the panel, right? And one of the things I wanted to also point out is that there's layers to it. It's complicated. There is no silver bullet. Just like resilience has layers, levels to it, the individual, interpersonal, institutional, and then you have your whole citywide layer. Racism works the same way. And we have internalized a lot of ideas that get in the way of us when we're in our official capacity, in our professional roles, because we think somehow we're a different person when we walk through the threshold of an organization, that now we're a professional. That's not me, I didn't do it. But that we are a professional and somehow we're all of a sudden rational human beings with no social conditioning, and we didn't grow up watching messages that communicate to us how people of color and other marginalized groups are and what we should expect from them. And then we go and we make decisions that impact entire communities' lives without them being involved, and without them receiving the benefits of the investments we make in the work that we claim to be doing to help those people. And I'm talking about wealth building. We're investing in resilience, and the people who are suffering the most are actually not receiving any of the financial benefits that are being invested in resilience. So as we move forward in this conversation, I hope that we are able to have a deeper, more sophisticated discussion about what are some of the actions that we need to take in order to address resilience in a way that doesn't make existing inequities any worse than they already are, but most importantly, that we're actually advancing racial equity, which is a more intentional, proactive stance where we're addressing all of these layers you see on the screen, and we're managing ourselves and we're holding each other accountable. So thank you very much. It's been an absolute pleasure. I'm going to be quiet now. I'm going to sit down, and I can't wait for your questions.
Now on that side, and sorry about the, I think there was a little bit of hiccup at the start of the slide, so the people on the right side of the room couldn't see. But I wanted to, I'm going to move over to audience questions really, really quickly, but I wanted to ask a sort of a bit of a dumb question. If I was going to say to each of you, if there was one thing that Toronto should do now to prepare itself for climate change, so taking the view of health, there was one thing, yeah, what would it be? Maybe start with Jeff.
Urban heat. Interventions that can lower the risk for urban heat on vulnerable populations, much the way that Elliot talked about before, those who are in older buildings that may not be air conditioned, or they don't have access to air conditioning or fans or those sorts of things, which there's a whole process that we learned from Australia on social cohesion and building social cohesion, so neighbors helping neighbors and identifying those vulnerabilities, particularly with older populations and children. But urban heat is the largest killer on Earth, much beyond flooding and other issues. So urban heat, I think, is an increasing stress in cities around the world, and in particular here in a place like Toronto, Chicago, it's going to continue to be an issue.
I mean, I should say implement the resilience strategy, but similar to what Jeff, I mean, I would say number one thing we could do is reduce poverty. Because at the end of the day, you know, one's ability to deal with a heat wave or a power failure or so on, there are a number of different correlations that we can make. Making people better off at home is number one.
I would say this isn't going to be specific. So two pieces. One is process, that we make sure that the people who are most impacted by climate change, which are people of color, poor people, people with disabilities, a whole range of socially vulnerable populations, are part of the process, because we don't know everything as folks who are experts. We have technical expertise, content expertise, but they're the context experts. And so if we're not doing that, we're not really solving for real problems that people are facing. And then, so the result, whatever we come out with on the other end, will be more robust. The other piece is implementation. I'm on the drumbeat of wealth building, so whatever we spend our money on, that we make sure that those same populations are also on the receiving end of those investments.
Okay, so all three of you, thank you. All three of you went to sort of system responses, which is understandable. Is there anything that we can do ourselves to, make ourselves more resilient to coming climate change?
I would say that's a very loaded question, because I think the system, and I hate to use that word because it's thrown about, but the system has to exist for people to be able to participate and connect to the opportunities that are presented. And I'm not quite sure that those systems are where they need to be. I can speak from the context of the United States. I can tell you they don't. And so to focus on the systems, I think, is very important. But there are smaller but impactful tactics. So one of the things that we, in doing research in New Orleans, understood that lots of populations, either poor communities who are sort of long-term poor communities, or new immigrants, were unbanked populations, meaning that they have no financial facility outside of, say, cash and cash systems. But in the event of a disaster, where particularly if you've spent all of your money up front on other things where people live, as we say, check to check, having savings that will allow you to sort of weather the storm, whether it be a weather event or a death in the family or any number of things that happen in communities. That was one of the number one things that came up about individual preparedness, about things that people could do proactively to prepare for any number of disruptions in their lives. And so we partnered with the United Way to create emergency savings accounts to do that sort of thing, to build. It's also tied to financial literacy and wealth building, but to start building that capacity to be proactive on the front end as something that an individual could do. That was a real first start that I think people could connect to, because, you know, we always face these tragedies in our lives, whether it be burying a family member that is costly, or preparing for a hurricane, or any number of things, disruption in job. So that was one of the first things that we found that was very impactful when talking to communities, was not just building financial literacy, but building it through being very proactive on the front end.
At the individual level, so let me preface it with this, because context is important. So when I say system, I am completely and totally acknowledging that we are part of the system as individuals, right? Systems don't exist unless we create them as people, right? So in that sense, I see that our personal responsibilities are multi-layered, and that we also think about power differently. So there's traditional power, right? This is all nerdy social theory of power stuff, but I think it's important to the conversation. So this idea that there's traditional power, and that's what we always talk about, you know, institutions and organizations and people who we've put in positions of power. But then there's our power within, who we are as people and our understanding of ourselves and what influenced us and why we believe what we believe and why we do what we do, and understanding those things. Our power too, our agency, our ability to see ourselves as people who actually have the ability to take action in our lives and in our communities. And then our power with, what happens when we come together in groups, which is an important part of resilience, and this idea of our connectedness to each other within our social groups and across social groups. And to be able to see the shared struggle that we're all facing, whether we're people of color, whether we're white, whether we have disability or don't, whatever the case, that there's actually a shared struggle there that is being distorted for us in all of the ways that we frame issues. We frame issues in the context of specific populations and not the issue themselves, which does not only impact one population. So I'll stop there.
I would say that the number one thing people can do is think about it. And we don't all have tons of luxury of resources and time, but you know, people are really starting to think a lot about climate change in terms of like the environment, in terms of our impact on the environment. And you're seeing a big movement away from plastic straws and that kind of stuff, which is fantastic. That's not going to help you for a second in a heat wave or a flood. You have to think about the climate's impact on us. And you know, I go back to where people live because I think that's really fundamental. It could be as simple as saying like, okay, we're not going to keep our photo albums in the basement, right? Because those are going to flood and we can't replace those. It could be something as life-saving as thinking, okay, I live on the 45th floor, whether it's an older tower or a brand new condominium. How am I going to get out, right? Yeah, absolutely. Absolutely. That's number one. So the point was made about people who can't get down 45 flights of stairs. So I think if I could say the number one thing people could do, think about it like this. There's our impact on the environment, and the environment's impact on us, and you can think about the things that you can do in your life on either one of those sides of the same coin.
Perfect. So, it's that time. It's about 40 minutes after lunch. It's warm, it's humid. You've had a lot of information. You're probably fading. And now I'm going to ask you to ask questions about climate change, which is a huge issue. And I'm hoping that you're still, yeah, go for it. Can we bring a, I thought that this might be tough, but no, great. Saviour, please. Can we get this one live? No, you're going to take my mic. Come here. If you just come here, you can take my mic and...
Thanks. Okay, I'll try and keep it quick. So it's really interesting to think about resilience in relation to natural disasters, just like a major event. I would argue that a man-made disaster that we're participating that contributes to climate change is car culture. And yesterday, a 58-year-old woman was hit by a truck at Yonge and Eglinton. 2018 in Toronto, 46 people, either on cycle or on foot, or perhaps even wheelchair, were killed by drivers. So I do a lot of advocacy for cycling infrastructure, but Atia spoke to something that I have a bit of a conflict with, which is looking at cycling infrastructure or better pedestrian infrastructure as a tool of gentrification. And so I'm just curious about how you guys negotiate that conflict between seeing this infrastructure will keep people of color, poor people who are disproportionately affected by these sorts of, by getting hit by cars, how you keep them safe without pushing them out of communities when you put that infrastructure in.
Hello, there we go. Since my name was said, I suppose I should say something. So the first thing is, one of the things that's actually a priority in Boston for a lot of our grassroots organizations and most community members is, I want to stay in my community. And anyone who knows anything about Boston, it's one of the most expensive cities in America, right? We're not the most, but we're climbing up there. And so this idea of gentrification, displacement came up immediately as part of the resilient strategy. And I'm just going to be real and honest with all of you. The research is very unclear about what you do to prevent gentrification or displacement for communities of color or any marginalized groups. However, there are some promising practices happening at the community level in the city of Boston that were really inspiring, that we actually included in the resilient strategy in spite of the lack of research. Number one, there are organizations who are looking at what happens when folks pass away, older adults, and the fact that there was this pattern in certain communities where there was no estate planning. And somehow it ended up going back to the city and so on and so forth, and you see what happens after that. And so there's some community organizations who are actually helping community members to do that estate planning, the older adults in the community, so that those homes don't get lost onto the market. Another promising practice was organizations that are setting up mini markets, mini real estate markets in the neighborhood first, so that residents get first dibs on being able to purchase houses that go on sale in the community before it goes on to the larger market. And then the other one really was about how do we make sure that that folks who do own their homes understand the trade-off of when you sell your home, right? Because, it's attractive. Someone knocks on your door and says, I'll give you $800,000 for your house, and you're poor and you're struggling to make ends meet. That's really attractive. But what are you going to do with that money? You can't stay in the city of Boston with that money because there's nothing to buy. And that means that you have to move outside the city. And what is that going to do? And what kind of quality home are you going to get outside the city? And what does it mean to your current financial situation of getting back and forth to work? So what are some of the other ways that we can leverage the wealth in our homes to be able to get additional income and money? That doesn't mean that we have to actually sell the property itself.
I just want to add just two quick points. The first one, you were talking about, human-caused. Climate change is human-caused, so let's not lose sight of that. But I just want to, the question of road safety is so important right now in the city, and I think I'm happy to. I don't know this, but I think it's bad everywhere. I think it's bad throughout, like, all neighborhoods, regardless of income, regardless of race. It is bad everywhere, and it just needs to be a priority absolutely everywhere.
Can I say?
Oh,
What?
yes.
Yes?
But I want to get more questions. So if we have more questioners,
Yes.
we're going to come.
Is really important is as communities plan for more cycle paths and things like that, to start thinking about the preservation of affordable housing and acquisition of affordable housing to continue to have that housing preserved for those communities. So as you're planning that infrastructure, your housing department or your development agency is also planning to invest in the acquisition and preservation of housing affordability, so you don't have the, in many instances, unintended consequences of gentrification that occurs because of this, which I think is a really important tool that governments can use.
Okay, so we've got a question there, Pete, we've got Nick, and we've got yourself. Okay.
I just wanted to touch back on Clam's comment about what would be the best thing that every individual could do in order to prepare themselves for, to be more resilient for whatever crisis might come, because many of us live through weather crises, but each of us live through crises every day behind the four walls of our home. And, when we talk about building empathy and compassion, we talk about heat, we talk about weather. Is there not a perspective that the best thing we can all do is actually get out and know your neighbor, know the people around you, social connection, build those bonds, build that community, so that when the crisis comes, rather than having to worry about getting down the 45 floors or finding a place with air conditioner, your neighbor across the street says, hey, come on over. And, I think back to the blackout of 2003 in Toronto. When I asked most people, how was that day for you? Most people say it was the greatest day that they've ever had, and they wish it could happen all over again because they built bonds and connections. So I was surprised that it was always about system or bank accounts, or what about just getting to know one another? And how can we encourage that more often?
Okay, let's take another one and we'll come back to the panel. Yeah. Nick? We'll come back.
Okay, thanks, Kwame. I don't want to come over all Greta Thunberg, but I'm not sure that the very helpful comments that everybody has made really get to the size of the problem that we're facing. As Ms. Thunberg would say, your house is on fire, guys, and you've got to fundamentally change the way of living. It's too late to stop that hotter, wetter, and wilder coming to you in Toronto, but you can do some things to slow it down, like why do I encounter everywhere in Toronto building 25, 35, 45, 55 high towers? Is that the way that Toronto wants to live? Why do I see people wanting to get Toronto itself denser and denser and denser with populations and cars? Is that the way Toronto wants to live? So why, at one level, these are fundamental political questions that can't reverse the change in the climate, but can slow it down. And on the other hand, while I'm very sympathetic to the idea that we should all be individually resilient, I guess coming from the UK, one thinks of all those people, who are stocking up their basements, who are waiting to live in the wild times, who are just making sure that they themselves are going to be okay. And I don't think that's what we need to do. if there, as there are, and we saw quite convincingly, real fundamental disparities in the vulnerability of populations mapped onto the vulnerability of areas, well, that's a massive question of starting to replan your towns, of starting to move populations, of beginning to think of what needs to be done at a fundamental level in policy, in politics, and in planning to take the seriousness of this seriously here in Toronto. I mean, it's not just in low-lying islands in the southern Pacific that this is going to happen. It's going to happen to your kids. So I've woken up to the climate crisis from someone who's 16 years old. I'm 72 years old. I'm not going to see it. But when I talk to people who've got kids of 2 and 3 and 4, they're going to see it. And so sorry, it's just a little impassioned plea to say all these things that you're saying are absolutely crucial, but I'm not sure they match up to the scale of the problem that your children and your children's children are going to face unless we start doing something serious. End of sermon.
Hey, so we're here.
I want to make a comment, and it's really nice to say, well, what should you get together with people? If you live in Toronto housing, which I do, and you're a senior and you want to meet someone, where are you going to meet? They have closed down all the community rooms in my building. Seniors don't have a place to meet. They're socially isolated. They're stuck in their apartments. You talk about social isolation as mental health. You got to know that's one problem with to keep healthy is social relationships. And what about the winter when it's icy cold out there and Toronto does not do the sidewalks? Fine for you, you could go out maybe in a car, but I got a walker. It takes me 20 minutes to walk across the street to get some food. What do I do? You have an air conditioning. You know, a lot of air conditioning, and they had rooms we could go if it's hot and there's air conditioning in there. They shut that up, so you're not even allowed in there. You wait Wheel-Trans, you wait outside the cold room hallway because they locked them up. They don't have any programs for us. People are lonely in their apartments. Seniors are not wanted. Seniors in our building with wheelchairs, they're not wanted. There's no home care. The dental care is 12 months long to get a dental care. So they're a vulnerable group, and no one listens to us.
These are some challenges.
So I think these are all very, very good comments and questions. I want to start off with the crisis comment, though, because I don't think myself or Elliot or Artia would disagree with you at all about the scale of the crisis that we are facing. And I think those of us who have been working in cities, and I would say particularly from the perspective of the US, have been very frustrated by the lack of institutional change that would allow for greater scale and the outsized role that the United States plays in sort of the global conversation about mitigation and adaptation. So yes, we have a challenge where we need to continue to mitigate what it is that mitigation meaning greenhouse gas reduction, carbon reduction, all those things. We have to continue to do that to at least slow what's already happening, but we have reached a point of no return and we have to adapt. And I think that's a massive thing that has to take place globally. And unfortunately, the politics have not aligned to allow that scale at a national level. So I think what you heard from us are just some tactics that have been used at more of the local level that tries to add up to that. So that's the first thing I want to say. The second thing I want to say about that, though, that I think goes to social cohesion and your question overall is, whose responsibility is it? So one of the conversations that I think many of us have had is there are vulnerable populations around the world. And at COP21 in Paris, one of the biggest conversations was, who pays for that? The United States and China are huge lead emitters in the world, polluters in the world, and so should the US and China pay more for the effects that are happening in the South Pacific right now, right? That's number one. At a sort of scale of inside a city, you know, I firmly believe, and I'm no longer in government, that it is the responsibility of the government to take care of poor and vulnerable populations. And so government has to step up and provide the gap that exists between where people who have resources, where they are in their preparedness, and where people who don't have resources. And then the last thing I'll say is one of the things that troubles me that I see in my own work is that places that have high vulnerability but have high levels of wealth are going to be okay. Those places that are poorer and have high vulnerability are the ones that we really need to pay attention to. And where are the resources going to come from to protect those populations, I think is a big issue that we have to face.
May I?
Yeah, absolutely, good.
So I'll push back a little bit on the crisis point on one thing you said, because I agree with you, obviously. But you said that, you know, we can slow it down, and we said that you won't see it. And I think on both of those cases, I think you're incorrect. You know, even if we stopped emitting right now, absolutely everywhere in the world, for the next 25 years, we're getting hotter, wetter, wilder before it starts to even out. So no matter what we do, we're not going to slow it down in the next 25 years. We need to adapt. And I mean, Toronto's warming at twice the rate of the rest of the world. The North is warming at 3 times the rate of the rest of the world. You will see it. And we're all going to see it. So I agree, but just on those 2 points. And I really appreciated your comments, ma'am, because I think it really, you know, going back to you know, Clam asked, what can we do, the one thing, you know, I think at the end of the day, adapting to climate change is all about housing, and it's all about jobs, right? And these are the things that would make us more resilient to all sorts of other things as well. But I mean, your points are, you know, nobody can disagree with you. It's a very, I mean, fundamentally, if we could fix Toronto community housing, we would make that many hundreds of thousands of people more resilient to climate change. And I think just, you know, to end on a positive note around the social cohesion point, that there are organizations in Toronto that I think are doing all of the things that I just said. You know, YMCA I think is a really good example of an organization that, you know, touches people. Pardon me? Yeah. Sorry? How do you get there? I think yeah, I know that there are a lot of systemic issues. I'm not saying it's perfect, just saying that there are organizations in the city that are taking that approach and that are making us more resilient.
Only thing I'll add is we talk about equity like it is, regardless of the form of equity, like it is an extracurricular activity. It is not an extracurricular activity. It actually has to be a part of what we do, and here's why. There is no business on the planet that designs a product for a generic population. Name the company. Businesses design products and services for a target market. They do research, they have focus groups, and they understand who the product and service is for. And they don't just have one product or service. They have multiple ones for all the different target markets that they have to serve. That's what it looks like and what it feels like if we are truly, as organizations, doing equity work. We're actually taking into our calculation the fact that there are different realities. And yes, for some people, you may have experienced a power outage and you got out and you got to meet your neighbors, while other people didn't, right? And both things can exist and be true because we live in a complex world. And so social cohesion is one component of multiple sets of strategies that we need to take if we're really going to do this well, right? And so I can know my neighbors and still struggle, even during a power outage, right? Because social capital isn't just about knowing other people. Social capital has layers to it, just like I showed earlier. And so you have to also be connected to people outside your community. And you have to be connected to people who can connect you to institutions and can help you navigate them, and resources, right? And so that's what social capital is. And so we have to be able to see that common thread of connection that heat waves and water and all of these things that climate change is going to bring to all of us, regardless of our wealth and our race. How do we connect the dots across the common struggle while we're acknowledging that there are differences in the experiences that we're having, and that's just real.
Another question.
Hello? Oh, okay, there we go.
Perfect.
So we've talked about the short-term climate change crisis quite a bit, but I was wondering, how do we balance planning for longer-term permanent changes? So say if areas become uninhabitable at a point, and ensure that we're not necessarily just getting lost in the crisis discussion, but also planning for what the future for livability is for these people as well.
Have you got questions on the left side, or are you content with the government as it is? No, or are you content with things as they are? So here.
Hello? Yeah. So I really appreciated the comment before around like context and where we are. And so kind of bringing it back to like the Toronto context a little bit. So we're all gathered here in Toronto. We're all gathered here on Indigenous lands. We're gathered here in a place where, you know, the enslavement of Black people existed for centuries, and where anti-Black racism is still very alive and well. You know, much of our green spaces around this city is being tended to by mainly racialized migrant workers who are living in a lot of precarity. And then I'm also thinking about these communities who are hardest hit by climate change, but are also the ones who have been on the front line and have been advocating since time around these issues, and have been practicing resilience in many, many ways. And so I guess my question is to everyone on the panel, and then, you know, even beyond in the room, how are we, beyond just like consulting, like how are we meaningfully being informed, like our conceptual framework, our process, our implementation, you know, by these communities? You know, like, you know, Indigenous communities here have always planned. They effectively stewarded the land, you know, for thousands of years. How are we meaningfully informing our practices around resilience through these communities who have been doing it for so long, especially when we're talking about equity, resiliency in urban spaces?
Okay, perfect. I was going to take one more question before going back. Are there any other questions on the left side? Happy, content with the world. Good. Let's go to the panel.
With your points and your question, which I think were all very good. I'll just touch on, I don't work for the city anymore, so I can say, you know, what I like. Like the city's not there yet, I would say, and the province is definitely not there, but getting there, I think, in terms of having lived experience as part of the process. And I think there are dozens of really good examples of practice at the city right now, like in city planning and social development and finance and so on, that I think we can build on. I think there's a recognition that, you mentioned anti-Black racism is a great example. The Confronting Anti-Black Racism strategy is a recognition that we have this larger problem of racism, and we're starting to get more sophisticated about thinking about what the dynamics of those things are, and of including community in that process. And I think with Indigenous communities, climate change offers a real opportunity because there's so much value in, like climate scientists really fundamentally recognize the value of Indigenous knowledge systems in terms of understanding climate change, and it's such a huge value that we can draw on here, and I would just earmark that as one place where I think we can continue to go further in terms of bringing community closer to government. I think on your point about short-term and long-term, I think if we knew the answer, it would be fantastic. I think Atia made the point, you know, only 10% of what we do is forward-thinking. You know, we say never waste a good crisis. Well, we keep wasting good crises. You know, 2017, the lake level was high. 2018, the waterfront was flooded. 2019, the waterfront is flooded. So I don't really know what the answer to your question is, but I think it's really fundamental when we think about resilience to find a way to transition from thinking about how do we just respond to something like building back better, rebuilding by design, and maybe in some cases, as we are doing in Canada, manage retreat.
I'll start with that first, and I think managed retreat is a conversation that is beginning, and in some places that unfortunately are directly impacted today, they're already having to have the conversation, right? So in different ways. So in Miami, for example, There clearly is the crisis of sea level rise for Miami, but it's not that simple because there are parts of Miami that are safer than other parts of Miami. The crisis in Miami is, as things are currently happening in the Caribbean, there has been, built off of social cohesion, a trajectory of populations migrating from the Caribbean to Miami for a very long period of time. And that can be tracked, and it's historic. And so we know that over the next several decades, that is going to only increase because of the effect of climate change in the Caribbean. We're already starting to see that, and we started to see it just this past week, where there have been large numbers of Bahamians moving into Miami, right, because of the crisis from the hurricane. So what they're thinking about is how to prepare Miami for the managed retreat of other countries in the Caribbean, because Miami has been seen as the quote-unquote safe space and safe place, Florida in general, for the Caribbean for a host of issues, economic and others, for a very long period of time. So they're preparing for the next 1 million, 2 million people that will be coming from the Caribbean into Miami. That's one way of thinking about it, while at the same time addressing their own Miami Beach issues of, sea level rise and those sorts of things. The second side of this, in the United States, the first place that is actively focusing on managed retreat is actually off the coast of Louisiana on an island called Ile de Jean-Charles, which has an indigenous population that's been there for a very, very long period of time. The island is virtually gone, and those populations are now having to relocate farther inland to another location. The reason why that's important in the conversation about how communities play a role in determining their own future, for two reasons. One, it was a very, very focused process because it is a Native community, and the way the United States government has displaced Native communities throughout its history, there was much more intentionality by the Obama administration on how to focus on that. And so that community actually developed its own strategy, and that Native community then found its place for relocation that then the government bought for them after they designed it themselves and went through their process of how to build a new community and a new life. It's the first in the United States. It's a pilot. It was not perfect, but is the first part of that President Obama started. The second will be a similar indigenous community in Alaska.
I will keep it brief. I think this idea of for the longer term, that we have to do all the things that were said, and we have to own our responsibility as individuals and organizations, right? The things that we're still doing right now as individuals, when we go home and we leave here, the types of things that we use that are not good for the environment, our behavior, all of the stuff that is the same context for looking at racism or any other form of injustice in terms of personal responsibility is the same thing with climate change. And so being able to look in the mirror, not just as individuals, but also as organizations, and government can't fix it, right? Government has a platform to stand on, to be a leader, to be sometimes a bully pulpit, to marshal other people's resources, because if you know anything about government, they actually don't have a lot of money, contrary to popular belief. And I can say that too now that I don't work for the city. And then this piece around being able to imagine what that responsibility is as an individual and as organizations. Because things like climate change and different forms of oppression feel so big and overwhelming that it seems like there's not really anything that any of us can do, but there's so much that all of us can be doing, where we can either be single points of failure, we could be single points of success, right? And it's the culmination of all of that heading in the same vision and direction that's going to make the big difference. And then the last thing I'll say around including populations meaningfully in decision-making processes is a challenge that we have everywhere on the planet. I did some work with the World Bank a couple of years ago with 14 of their grantees. And they were all proposing different projects for their cities within their countries, and being able to embed social equity into whatever those projects were was the role that we were playing in working with them. And I share that with you because within all of those contexts, it was like pulling teeth to get people to think outside of them being the only decision makers and experts on what needed to happen in those cities versus being I don't like using the word inclusive, so I'm not going to say that, but including people who are being impacted and who we're trying to support, and that we shouldn't be just doing stuff to them, that we have to be doing this work with them, to Jeff's point earlier. And so we have some pockets of excellence around the world where people are doing those things. The issue is, how do we flip that so that it's not an isolated thing, that it's actually scaled up and that's common practice and that's normalized.
Last word.
Just add one last thing to the short-term, long-term thing that I remembered as Atia was talking. It's actually a lesson that another CRO gave me. He said that I was saying that we're going to go for some low-hanging fruit at the beginning, and he said that's a waste of time, because you'll find that the low-hanging fruit is more firmly attached to the tree than you thought. So put that effort on the high-hanging fruit, and maybe you'll get one that makes a big difference. And so maybe that's a thought just to leave with as we go into our breakout sessions now, to think about the specific things that, and to your point earlier about crises, there's the low-hanging fruit, but let's think about some of the big ideas that could really make a difference.
Okay, so wonderful, and thank you very much for the panel. Can we thank them in the normal way? So, we've got some images there. We're talking about harvesting your ideas, weren't we? And this is what we're going to do next. The next 1.5 hours is getting into workshops, 4 workshops, and then we're going to go through a process to get your reflections, to get some actionable ideas out there. So so it'd be great. You've had a lot of information. Now it's your turn. Now it's your time to really give back and tell us what you think and tell us your ideas. There will be a housing workshop in the debates room. There'll be a health systems workshop in the music room. There'll be a climate resilience workshop in the East Common room, and there'll be a social inclusion workshop in the South dining room. Then after the workshops, we've got a fabulous keynote that we have flown in all the way from the UK. Fabulous, wonderful end of the day. There's also more Ritalin, that Greg Franksen, Ritalin that is. And so we're going to have a great end of the day. It did make it sound like I was going to give you all drugs there just for a moment. That's what we need to do. They start at 2:30. It's an interesting couple of different images that will stay with me from this panel. One is the idea of low-hanging fruit at harvest time. And I always joke about low-hanging fruit, because generally it's rotten. Yeah, if you can see it, all the bugs can see it, all the birds can see it, and it's just sitting there, and usually it's not worth having. So low-hanging fruit, unless you're a really early adopter, you need a stretch idea. You need to be thinking bigger than that. And I also was really taken by Nick's idea of the house is burning, what are you guys doing? Yeah, the ideas, you have to stop more of this. You have to stop more climate change. And I totally agree with him. But what we do now makes a difference. And actually, if you're outside your burning house, you sort of should do something about it. And you should do something for your neighbor, and you should do something for your community, because when that fire spreads, that's a problem, okay? So what we do now on resilience and climate change and equity make a difference. They make a difference now, and we're paying it down in the long run. So when you're thinking about your ideas, yeah, think of today, think of tomorrow, think of the big issues, but also think of things we can do now that can make a difference. So, fabulous panel. Wonderful to have international voices trying to help us think through what we're going to do in Toronto. Now it's really going to be great to have Toronto voices thinking through on those 4 issues, things that we can do today. Okay, thanks very much.